Stanford University.
Good morning. Well, there's been a lot of movement in the hospital food area lately, and what we'd like to do this morning with this session is go from a national survey of what's going on across the country and then bring it back locally to the Bay Area and talk about both broadly what's going on in the Bay Area and then specifically some of the innovations being taken right here in our own backyard. And our team will then talk about a project we undertook here at Stanford, the Stanford Food Project over the last year, and some of the information we've begun to collect in that regard about food venues at Stanford. So, hospital food has been in the news, and for the most part, it's been to talk about the deplorable aspects of hospital food, from it's so bad that patients won't eat it, to hospital food is shockingly unhealthy, and hospital food needs urgent treatment. So these are some plates that you may have seen in hospitals over the years, and this has now moved globally. And in the UK, an article indicated that decent hospital food doesn't just help patients, it aids farmers too. And this was an article by the Prince of Wales, who has long been known for his work in organic and healthy foods. And he had a quote that only the British turn of phrase can express: hospital food has a reputation for being horrid, inedible, and generally vile. But Prince Charles has now honored hospitals who are making food fit for a king, and he gives awards now to hospitals who are improving food. Now, what really got the media in a tizzy was an article that appeared early this year by Lenny Lesser and colleagues, which was a survey of 14 tertiary care children's hospitals in California, and looked at what the cafeteria food was like. And the surprising outcome was that most of them had food worse than fast food restaurants. And they concluded that a minority, 7%, had entrees and salads that met a reasonable standard for being healthy. So of course, the media had a real free-for-all on this, and this went viral, really. Children's hospitals serve up junk food. Food is rated largely unhealthy. Food served in many children's hospitals in California is unhealthy. So since Stanford was one of those hospitals, everybody there was freaking out on these wonderful headlines, and began to make substantive changes. Now, a lot of these changes are really being supported by an increasing amount of research on the impact of food and health. And we now know from a building body of work on nutrigenomics and nutrigenetics that what we eat can modify health outcomes. And work on epigenetics is telling us that food can impact gene expression. And in fact, your DNA is not your destiny, and you are what you eat. So there are a number of groups that started as grassroots organizations that are now become national, and these are three of the important ones. Nationally, Healthcare Without Harm started maybe 10 years or so ago, and now it's an international coalition of 470 organizations in 52 countries. And they're working to transform the health industry and make sure hospitals and other healthcare organizations are not causing harm to individual health and the environment. Physicians for Social Responsibility has a Bay Area contingent that works with Healthcare Without Harm, particularly in the food arena, to try to get hospitals locally to be doing more work on healthy hospitals. And they have a Healthy Food and Healthcare initiative, and there's a pledge that hospitals take for fresh, local, and sustainable food. And the national initiative of Healthcare Without Harm is working with these local hospitals who take this, or these hospitals across the country who take this pledge to try to change the food at these hospitals in whatever steps they can make over time. 396 hospitals have signed this pledge so far, and they are doing various things from bringing farmers markets on campus, getting local sustainable food, composting waste, and each one is doing a different number of things. And out of this 396 hospitals, 5 have been cited for doing exceptional work, including 2 who, representatives of whom will be with us today to talk about the work that they're doing here in the Bay Area, UCSF Medical Center and Kaiser Permanente hospitals. Food Matters is an organization that does education and advocacy, again, trying to provide guidance to patients, to the community about what is healthy eating, to try to work within healthcare facilities to model healthy behavior in terms of food, and to work with the community to support policies that will make food more accessible and a healthy and fair food system. Now, many organizations are now jumping on the bandwagon. The American Medical Association passed a resolution supporting sustainable food systems. The Center for Disease Control has on their website a new initiative for improving hospital food and beverage environments. They're encouraging these things among hospitals. New York City's Department of Health initiated a healthy hospital food initiative to try to work with New York City hospitals, again, to improve the food offered in these venues. And there's now a Food Med conference, which is the nation's premier conference on sustainable foods and healthcare. So there's a lot of activity going on in many different arenas that are moving things forward. The Bay Area Hospital Leadership Team is something that Dr. Maring is going to talk about momentarily, because he's been leader there, and they're trying to work to bring together hospitals in the Bay Area to be able to procure food and do other healthy, environmentally sustainable purchases. Now, more recently, the media is changing its tone a bit. Can we cure hospital food? Gel, no. Hospital food goes upscale. Hospitals try another marketing gimmick, food that won't make you sick, and reinventing hospital food. Well, what does this reinvention of hospital food actually look like? So here's an example. You see this tray, which many of you have probably experienced over your lifetimes in hospitals of one another, and this is one of the new permutations of food being served maybe soon at a hospital near you. At Memorial Sloan Kettering in Cancer Hospital in New York, they've paired with the Culinary Institute of America to bring chefs in to work with young children with cancer who are on chemotherapy and may not be able to feel like eating, and work with those kids to make food that's palatable so that they want to eat it. And one of the hospitals that was here last year at Henry Ford in West Bloomfield, they are taking it to another level. This is how they're wording it: transforming hospital food, taking health and healing beyond the boundaries of imagination. And their hospital cafeteria has become a destination restaurant for the community. And with philanthropic money, they're building a greenhouse and planting things on campus, so they're really moving ahead. At New Milford Hospital, they started a Plow to Plate program in 2006, and bridging the community and the hospital, and this is some of the beautiful food that they're now serving, working with local farmers as well. And in Oregon, 20-something hospital systems around Oregon and southern Washington state are working together to serve healthier meals, to buy local and sustainable, getting healthy vending machine, and talk to each other about how to improve composting and those kinds of things. Now, more recent, you may know about the green roof movement around the country. Well, more recently, now hospitals are taking it to rooftop farms. And this is from Stony Brook Hospital in New York that's now has a rooftop farm on their campus. And internationally, you see the, the Changi General Hospital in Singapore has a hydroponic tomatoes growing on their roof, and this beautiful roof garden at the pediatric hospital in Florence, Italy, with a greenhouse is really spectacular. So hospitals are now beginning to grow their own food. So the food service industry, of course, has taken notice. There are many people who've been pushing the food service industry, who actually provides the food on these various hospitals, to make changes, to make significant changes in what they provide. And many hospitals, particularly after that pediatric article, have grouped together to put pressure on these groups. And so they are working to improve hospital food service. It may be slow in coming, but it's beginning to come. So there is much to be excited about. I think many of us who were frustrated at the slow pace of things are now more excited about the more rapid pace, as more and more people build a critical mass and work together to learn from each other on how better to achieve the issues. In cafeterias, the issues are different from providing patient food, but people are making a lot of progress in these arenas, and I think it's a very exciting future. There's interesting opportunities for researching these changes as they're being made, and we look forward to what's going to come in the future. So now I would like to bring it back to the Bay Area and introduce Dr. Preston Maring from Kaiser Permanente, who's going to talk about his initiatives here to bring hospitals together in the Bay Area to provide more sustainable food in the hospital environments. And he's been a pioneer in bringing farmers markets to the hospital environment.
Thanks, Freddie. You know, it might be a while, but maybe someday we'll have hospitals that get 5 stars in the Medicare quality rating and 3 stars from Michelin. I think that it might be a stretch. I've been at Kaiser Permanente for practicing medicine and women's health care for over 40 years at this point. And it's, I don't have any slides, thanks. And sure. And it's been clear to me, obviously, that as Freddie said, it's not all DNA, what you eat matters. So what we did in 2003 to try to make the right thing easy to do was we put one of the first hospital-based farmers markets in the country, as far as we know. I think there was one at Duke that started in 2000. But we put an organic market out in front of my hospital in Oakland. And it was like a block party out there on day one. The strawberry vendors sold out, did $2,000 worth of business. A member ran up to me and short of breath saying, "How much longer is the market going to be open?" And I said, "Well, at least another hour." She went, "Oh, good. I've got to take my husband to the emergency room and I'll be right back." You know, so it was a good thing. Kaiser Permanente now has 52 farmers markets at its facilities around the country. I think there are at least 50 more in other healthcare systems. And we're sponsoring other farmers markets too out in the community, like we sponsor one in Watts on Saturday mornings. There are 20 farmers now in a neighborhood with no grocery stores. So the markets grew. That was a good thing. You could choose a fresh peach in the middle of July instead of a Snickers bar. It makes the right thing easier to do. In 2006, we said, but wait a minute, you know, of course, we've got 7,000 inpatient meals a day. What are we doing there? Well, we examined where we were getting our food, and we looked at all the fresh fruits and vegetables that came in. We were getting, you know, several tons of red seedless grapes from Chile that were being shipped 7,000 miles to our hospital system. And on Friday mornings, Marlene Gonzalez of the Lone Oak Ranch from Reedley, California, was selling organic red seedless grapes right out in front. And we're saying, wait a minute, there's a disconnect here. We were getting tons of black plums in from Idaho, and they are grown right here in the Central Valley. So we began a process of examining our inpatient food system just for Kaiser Permanente. At the same time, there was the Bay Area Hospital Leadership Team coming together, 4 or 5 hospital systems, UC, John Muir, San Francisco VA, Kaiser, and others were working with the Bay Area Physicians for Social Responsibility on a variety of projects to try to source more sustainable food into the hospitals. They were working on just kind of, you know, sort of individual projects. Well, last year, what we did was we brought together Those hospitals, we brought together large distributors like Cisco and Bay Cities Produce. We brought together some organic farmers, and we also invited leaders from the Community Alliance with Family Farmers. It's a nonprofit that's been in California well over 30 years. It's a progressive, on-the-ground nonprofit whose job it is, whose goal, mission it is to support small family farmers, particularly sustainable agriculture. And CAF also has policy connections in Sacramento. So CAF, Physician for Social Responsibility, farmers, distributors, and now expanded number of hospitals, which now recently is going to be including Lucille Packard Children's Hospital food service leaders, San Francisco General food service leaders. The group also includes Stanford University's purchasing for its 14,000 meals a day. We've got 8 hospitals plus Stanford University serving collectively tens of thousands of meals a day to the community from all parts of our community, and they are coming together to examine the issues at 3 levels. You know, you've got a 3-legged stool. The supply side are the issues for the farmers. There are farmers out there with 10 acres. They're only farming 3 because they don't have a for sure marketplace of what they're going to do with their crops. A goal here, and this is the kind of work the Community Alliance with Family Farmers does, can work with a farmer, help that farmer become food safety certified, and instead of growing 3 acres, just maybe that farmer can grow 10 acres, sell it to the institutional purchasers through the distribution system, and maybe send their kids to school. The distributors are changing their practices in response to the demands from the large institutional purchasers. Cisco, for example, right here at Fresh Point in South San Francisco, is they're working hard to make sure that their systems can show the traceability from farm to institution. Before, when a hospital purchaser like Dan Henroyd is going to speak in a minute up at UCSF, would go on the punch sheet to see what was going to be ordered, it was hard to tell where the food was coming from. Well, the distributors are now, they understand that large institutional purchasers want to know. They want to know back to the farm, what are we getting for our food dollar? So the distributors are coming along. And the hospitals, of course, a challenge for them is to change some of their practices to meet the kind of food that comes in. The cherry tomatoes may not always be stemmed just the way you want them in this newer food economy. You may be modifying your menus more at a hospital level based on what's seasonally available. But ultimately, food that is grown not laden with organophosphate pesticides and all kinds of other chemicals, chemical fertilizers and pesticides. Food that's grown that way, ultimately, it's good for you, it's good for your children, it's also good for the planet, but it's also good for the farm workers. I mean, there's increasing bodies of data that what we choose to feed our families has a huge impact too on the people that grow the food for us. And there are real leaders in trying to bring good food in and to really promote this cause. One of those is Dan Henroyd. I'd like to introduce him now from UCSF.
Preston is very modest. If you have anybody seen HBO's Way of the Nation, my colleague over there is a very prominent figure in that special, and he's done a great job to move this chain nationally. The talk is about hospital food, but I think one of the things that I wanted to do is sort of give the institutional or the operator perspective, because I guarantee you have an opinion about what my team and I do for a living, because everybody eats. And so the people who are actually preparing the food and serving the food, it does make a huge difference. We have a saying in our department that there's no other department in the hospital that can personally and directly touch anyone who walks the doors of the institution and perhaps change their day simply by what they're doing. The other thing is, great food isn't enough. It is about service. It is about the environment in which you consume the food, and we have a very simple formula: great food, great service, and a great environment to eat it equals a great dining experience. So for those of you who don't know a whole lot about what we do, I always like to have some context to what a speaker is talking about. This is a little bit about us in terms of what we're doing. We're 2 hospitals now. In the next 2 years, we'll be 4 hospitals spread throughout the Bay Area. And again, I have a very old building. It's a 1950s era kitchen, so I'm a little bit constrained there. This is where we're at, and again, for all those little red dots you see up there, those where my support is to do IT and other things. So we're very dispersed in the city of San Francisco. This is the main campus where I'm based. We do have a whole lot of competition all around us. So while it's great that I can go buy organic, do other things, and I know you can't read this, but all of the red boxes, all the pullouts there, all these other food vendors that are actually contracted to the university all around me that are selling food. And there's Jamba Juice and Panda Express and all the others. On top of that, I'm paying a unionized wage with benefits. These guys are not. They can undercut me any day of the week and twice on Sunday on price because their overhead expenses are phenomenally lower than what I am. So this is the context. And people can pretty much walk out the front of the hospital, which is the blue ones at the top, and then walk right across the street to the union and take their food dollars with them. So I have to compete on quality, on price, and perceived value as well as environment. This is what my team and I do every single year. We have a couple of hospitals. We serve many, many meals. We are trying to do a room service environment where basically instead of me telling you when you eat, we're going to let you tell us when you're going to eat. We're going to do it within our menu. And then on top of that, I have to make sure that it's within the context of the diet that the physician has prescribed. And in addition to that, there's an allusion to food safety. I have to make sure that the food that I'm serving is safe. So while I would love to partner with every single local farmer, if I don't know what their food safety program is on farm, that isn't going to pull any weight when the Centers for Medicaid and Medicare Services surveyor is in my front door saying, show me how the food and the produce that you serve is safe. And if the small farmer can't do that, that is a really, really big issue and a huge barrier to sort of getting into the marketplace. And I do all of this out of one kitchen from 1950. So we have a huge scope of service for what we do. And again, it makes it a little bit challenging, but it's a huge opportunity as well. So for us, making food healthy, making food sustainable isn't new. We've been doing this for a while, and I'll talk about that in a second, but part of it is just making the fundamental commitment. When you're having the discussions about the research opportunities and the partnership opportunities, don't leave the operators out. There's a lot of us out there that are very interested and very engaged, and we've probably been doing this a lot longer than you think in terms of trying to make a difference in what we do. I spend $6.5 million a year on food and food-related supplies. That's a heck of a lot of spend, and I'm just one hospital institution and then partner with a whole lot of others. So this is what we do, and part of it is measuring and trying to figure out where you are. So having 20% of your sales from sustainable sources, and I'll answer that what is sustainable question in a second. This is sort of kind of the framework that we are based on. And you can kind of get an idea of what is considered to be sustainable, at least for our perspective. And you can have all kinds of discussions about whether or not this is right or wrong, or it could be better, or the fact that it should be more than one criteria or whatever, but you gotta start somewhere. And so this is the framework within which that we are, in fact, working. And there's a lot of different perspectives, whether it's living wages, whether it's seafood, whether it's local, whether it's organic, to really guide and direct our framework. One of our successes has been working with CAF and Bay Cities Produce and really have some traceability to the local level. Working with a company like Bay Cities Produce, they actually aggregate produce from local farms and other CSAs from 17 counties around San Francisco. So for me, I can't have a whole lot of vendors. My dock is really, really old, and I'm having to get deliveries from all kinds of other hospital departments. So I need to really get it from one source, and then to have that assurance that the food is being served safe and processed safely at Bay Cities helps. But what we're able to do with Bay Cities is really get down pretty granularly, and on every single invoice that I receive, I know whether it's from 100 miles away, 250, the rest of California. If it's not in California, I know the country of origin, and we actually track and trend that throughout the year. And this is sort of what that looks like. This is a couple of years worth of data for our fiscal year. The green on top is sort of where we're at, and so we can trend this throughout the year and say, how are we doing, and how are we making purchases every single week, every single day, to make a difference and have an impact on the health and safety, as well as support the local economy for what we're doing to serve our patients and our customers. Like I said, we've been doing this a while. This is just sort of a snapshot timeline. It's a little hard to read, and I'll blow through it, but I think the slides and everything will be available later. But we made our formal commitment really in 2008, and this is actually before the University of California had a formal policy. And each of these milestones has really represented some things that we've made in terms of switching to all natural hormone-free beef patties in 2010. You can get an idea of the local partners and the brands that we're trying to support with our food dollar to actually, in fact, make a difference. Again, it's a progression, it's a journey. It's making sure that we are, in fact, tracking and trending and then marketing what we're doing. Part of the reason that those stories that Freddie showed get there because we do a really poor job of marketing the great things that we're already doing. We renovated our cafe a couple of years ago, and I love to believe, because people tell me we achieved our goal of basically having an oasis within a hospital, because most people don't want to be in hospitals. There's a reason that they're there, and they're not there for the food, let me assure you. But we're trying to change that difference, change that stigma, because next to school food, I don't think hospital food probably gets the second worst rap out of anybody who's doing this. Making sure that, again, we're looking at all types of vendors, looking at companies like Alvarado Street that are serving healthy, high-fiber products in addition to being locally prepared, is very, very key and important to us. So when we do that, we actually look at these metrics. So this is where my $6.5 million spend is. And so I'm getting there towards that 20% by 2020, but I still have a ways to go. But it is trying to chip away and to make a difference. And sometimes make a principled stand. So for example, one of our successes this year is we found a local vendor partnering with a couple of other hospitals to find liquid cage-free eggs. And I use a lot of eggs, as you can imagine. That's my highest #1 item that I use out of anything. And we went and partnered with other hospitals, including John Muir, San Francisco VA, to say, can we agree on a specification to say this is what those eggs will look like? And can this local vendor, in fact, meet our demand? And I'm going to be challenged in the spring when food prices go really crazy in terms of keeping in with that spend. So here's our challenges. Which comes first, the chicken or the egg? Which comes first, the supply or the demand? How can we, in fact, get through that? We don't always have the purchase. I'm viewed as an overhead expense in a hospital stay. So when healthcare reform comes down and hospitals are challenged to cut their budgets, my budget will probably get cut. And so when I'm spending more to support the local economy, to support great products that cost a little bit more, I'm going to be challenged to continue to do that. So do they want it? Again, people make decisions with their pocketbook, and so we'll see how that goes. Creating those partnerships, and I talked about that with Bay Cities as well. Can we, in fact, encourage things with the big broadline distributors to make a difference and track their food, and also say, we want this stuff, please come back with some better prices, because here's our spend, and here's the spend of our local colleagues as well as our other national colleagues. Making sure that we have a way to measure that. I've got a lot of moving parts with a very huge department, and that makes it key. So what's next for us? We need to expand our partnership with CAF. We need to have our chefs in sync with the growing cycles and the planting cycles that are there. We're looking at some interesting opportunities to take the seconds that is being plowed under in the field and see if we can come up with products that all of the hospital leadership team can in fact use. And then making sure that we're getting out of the box with proteins. Proteins are hard. Produce is easy by comparison to make sure that we're in fact serving things safe. So with that, I really thank you for your attention, and I'll turn it over to Brianne.
Okay, so for the rest of the session, we're going to talk about a Stanford food project that we undertook this year to try to get a sense of what the different venues on campus are doing, because as with UCSF, we have several different food service providers in different venues on campus. And so we had a group of undergraduate students who have worked together to make this project happen. Christy Bryden is going to present the data, but also working on this project have been Mallory Smith, Heidi Von Korf, and then there was a group of students, Jake Rosenberg, Kristen Wong, and Shubha Bhatt, who did work on photography. So they all contributed, and Christy's going to present some of the data that we've collected.
Okay, do I press the green button? No. How do I go forward? Oh, there we go. Okay. Hello. So for this project, first we wanted to look at what food is available on campus. So these are sort of the opportunities that would be available to someone like Stanford Hospital. So we've looked at what's going on in hospitals around the nation, what's going on in the Bay Area. Here's what's going on in Stanford. So we wanted to look at 4 different venues on Stanford campus that each have different food service providers. So here we have Arriaga Dining, which is part of Stanford Dining. We have Nexus Cafe, which works under Guggenheimer, Stanford Hospital, which works with Sodexo, and Arbuckle Cafe, which works under Bon Appetit. So we looked at a lot of different things within each of these venues. We're going to show you just a sampling of what we found this summer, and hopefully it'll be just a base point so we can move forward in the future. So the 3 main chapters of our research were really looking at nutrition, looking at what are the nutrition facts of things that are being served, looking at sustainability, what sort of vendors are venues using, and what are they using in terms of composting and recycling, and also with messaging. How does the venue communicate with the consumer in terms of guiding them towards healthier choices and giving information about nutrition in general? So when we were looking at nutrition, we wanted to look at nutrition in the more traditional sense. What's the caloric content of the entree? What about sodium and saturated fat? But as you can see in the first row of the chart here, nutrition facts aren't really available to the consumer in most of the venues that we looked at. We saw that Stanford Hospital has nutrition facts for a few of the entrees that are sold. We saw them over at the grills and the soups, and they do have a Wellness and You program by Sodexo that designates one entree as sort of the healthiest choice of the day. But in general, we weren't really finding that information. Then we wanted to, they do have some reasons. Arbuckle says that it rotates its menu too often to be able to evaluate that nutrition information. And Stanford Dining says it doesn't really want to make that information available to the college student population, which is at a higher risk for eating disorders. Then we wanted to look at just a few specific things within the vendors, and a couple of them that jumped out the most to us were things like, do they use a fryer? Are they having a lot of fried chicken fingers and things like that? And we found that they're really not. Every one of the venues has French fries every day, but in general, that's pretty much what the only thing they use the fryer for. Next, we were looking at bread. Is there whole grain bread available, not just whole wheat? And there's really not. We saw, just sort of generic whole wheat brands. And then a main sort of healthy food hub in each of the venues, we see the salad bar, and it's pretty significant in most of the venues. So we decided that one way to compare the salad bars would be to look at the number of non-lettuce items. So how many vegetables do they have? Is it an appealing salad bar, or is it pretty basic? And we found that at Nexus and Arbuckle, they have up to 26 sort of different vegetables and other toppings for your salad, whereas at Stanford Hospital, they only had 12. Moving on with nutrition, a big part of sales at all of the venues is beverages. So we found that one easy thing to measure would be to look at the number of bottled beverages that they sell that have added sweeteners. Anything from sucrose to aspartame to stevia extract, anything with an added sweetener. And we see that at Stanford Hospital, 76% of their beverages have an added sweetener in them. And at Arbuckle and Nexus, it's about 64%. Then looking at what's offered, what are people actually buying? And since it was hard to see what types of beverages people were buying in terms of if they buy the unsweetened flavor or the one with 26 grams of sugar, we decided just to look at soda, because we know that all soda has an added sweetener in it. And we see that at Stanford Hospital, 39% of the beverages sold are soda, Coke, Sprite, Pepsi, something like that. And that this jumps up to 48% at Nexus. So regardless of how much you're offering, people really are buying it. Then moving on to our second portion of the research, we were looking at messaging. What sort of signage is available in the venues? Do they give people information about nutrition or about what they should choose? At Stanford Hospital, we see that Sodexo, again, has signs sort of guiding people away from the cookies and towards the fruit, and they have brochures about, preventing chronic illness with food. And at Arbuckle and Nexus, it's more basic, sort of table tents and signs about antioxidants, omega-3s, something really general. And at Stanford Dining, we had something just sort of explaining what sort of symbols they use to identify benefits of certain entrees. But again, pretty basic. Then we wanted to compare how does the messaging online on someone's website, the sort of theoretical information, compare to what actually happens within the venue. And we see that in Arbuckle, they have very general information about nutrition, portion sizes, sustainability, what sort of vendors they use, and yet in the actual Arbuckle Cafe, we don't see much of anything at all really communicating to the consumers. In Nexus Cafe, their website has a lot of information about nutrition. They have nutrition facts for a lot of their entrees, but not all. And they also, they promote veganism, they warn you against sodium, they warn against added sugars. And yet we see that on site, there aren't many vegan dishes available. 25% of the entrees have over 1,000 milligrams of sodium. And as we see, soda is a huge part of their beverage sales, so obviously the sugar message isn't really getting to the consumers. Next, our third and final part of the research was looking at sustainability. And we realized that sustainability has many different sides. There are a lot of different things to look at in terms of a food venue. But a couple of things that really jumped out to us the most were, one, the percent of meat that's raised without the routine use of antibiotics. Is that something that's a priority to these venues? And we found that the numbers weren't available for all of our venues, but we do see that Arbuckle is at 100%, and Stanford Dining is at about 14%. Stanford Hospital didn't have that number available. Looking at seafood, we see who follows the Monterey-based Seafood Watch guidelines. Again, not available for everyone. Arbuckle, again, at 100%. Stanford's about 62% in the green. And again, with Stanford Hospital, not available. So then a second part of sustainability, we're looking at what percentage of their purchases are local purchases. And while we see that at least 3 of the 4 venues do have efforts to increase local purchases, and they do sort of pay some attention to that, the actual percentages aren't very high. And we see that Arbuckle, they're aiming for 20% local. Stanford Dining has different percentages depending on what type of product you're looking at. But in general, there's some room to grow there. Then looking at waste, we wanted to see who tracks their waste, who trains kitchen staff to cut down on pre-consumer waste, and who looks at composting and recycling in order to divert some of the waste at the end of the day. Arbuckle Cafe diverts 60% of its waste through compost and recycling. Stanford Dining composts 100% of the food waste. And with Stanford Hospital and Nexus, they aren't really tracked. Stanford Hospital is hoping to begin tracking it on a monthly basis, but not daily. And haven't begun that yet. So as you can see with the pictures of all the different venues here, we can see that all of them vary a lot in terms of their commitment and efforts in sustainability, in nutrition, and in messaging. But we hope that this sort of provides us all with an opportunity for more research and more collaboration so we can promote some positive change in the future. Thank you.
Okay, thanks. And now I'd like to invite up Dr. Shad Marvasti, who was my co-conspirator in crime in directing this Stanford Food Project, and he's going to talk about sort of bringing some conclusions and where we might go from here in the future with some of these efforts. Dr. Marvasti.
Okay. All right, how's everybody doing? Okay. So first of all, I'd like to thank everybody for coming here. I'd actually like to acknowledge, I actually have 2 tasks that I've been charged with by Christopher Gardner. One is to kind of summarize what we're doing in our next steps, but also to leave you with a positive charge in terms of where we're going next, all together as a Food Summit, as having the honor of being the last presenter of this morning's session. And we have a great day ahead even after this. So to begin with, I want to talk a little bit about kind of what we just said and kind of wrap things up here and kind of talk about the next steps. So what you just heard right now is that there's a lot happening in terms of hospital food and a lot happening at the national level, also some really wonderful initiatives locally. And there's some things that we're starting to do here and people are paying attention to on this campus, which really merit more attention and more study. So this is an interesting little piece here. You might have seen this. This is actually from the UK, from the Telegraph. I picked this up. It's a photo taken, disgusted, again, back to the British verbiage there. They were disgusted with the quality of his meals. So this idea of hospital food, has been around. It's been an issue for a long time, and this is something that we need to change. And as you saw, the subtitle is hospital food, but we're looking at food as medicine. And obviously, I'm a physician. I'm a family medicine physician. I like to think about food as medicine, and I'm going to talk a little bit more about that and why this is important from a health perspective, both for individuals and the environment. But getting back to hospital food and talking about what the next steps are, so there's a lot of potential here. As Christopher has mentioned, as you've seen throughout this day, the resources and the opportunities are really immense in terms of connecting the research aspect of what's happening in terms of Stanford University with the community. So in terms of hospital food, with what you just saw, that was just a taste of some of the data that we basically picked up looking at the different venues. And that was just a preliminary needs assessment to see what the status is. So there's designing surveys, which is really looking at surveys that we could do that are really focused on consumers. And as consumers, not just the patients, but also the staff, also their families. How many of you have been to hospitals where you've actually had a family member yourself bring food from the outside? Show of hands, right. So these are really important issues to consider, to talk about, to see, well, how much of this is happening, how much is actually affecting the people who are in the hospital setting, the consumers, their families, and really asking hypothesis-driven questions. Does this impact hospital stay? Does this impact rates of healing and how long they're in the hospital? Does it impact their actual health? Are there outcomes? Are there ways to actually assess the nutritional value and sustainability and all these different measures that we're talking about, which are really big, complicated items that have a lot of different pieces to them, right? So developing a hospital food assessment tool. There's a couple pioneers, Lenny Lester, Marjorie Freeman, have developed really interesting, great tools. We're hoping to build on that. So some of the next step things that we're hoping to do is to build on these things and develop some kind of food assessment tool. So we can talk together about that and we can work on that together. Other things that would be really neat is then afterwards, once we do the needs assessment, once we see what the consumers and the people want, is doing some kind of intervention project, right? Changing the food options, see what happens, giving more nutritional education, more specific education. For example, we could do cooking demonstrations where we actually take patients who have cancer, take patients who have diabetes or pre-diabetic and all this whole spectrum of chronic disease and really teach them how to cook and how to purchase healthy food. And then you can go out to your farmer's market right there and get it in your own community. How about a medicinal food garden? Something that's local, sustainable, and nutritious. So, and maybe we can build to something even more, and Stanford University and Stanford Hospital and all of us here and all the community, we can maybe even have a hospital food symposium here. So I think there's a lot of different places we can go, a lot of different steps, and we'd love to explore that with all of you and really learn from each other. And that's really what this whole day is about. It's about learning from each other and creating that community of learning, as Christopher reminded us this morning. So going back to this whole issue of food as medicine, I'm a physician, right? And so people are going to come and ask me, and they say, hey, doctor, what should I eat? Now, how much education in nutrition do I get? Right? On average, the average is actually 2.5 hours nationally looking at how much nutrition education. Now, Christopher Gardner's helping with that here at Stanford. I think we have more than 2.5 hours in terms of the exposure to nutrition here, but there's a lot more that we can do. So when you come and ask me as a physician, what should I eat? Is this food sustainable? Is this food actually going to make me feel better? Is this food healthy for me, healthy for the planet? Or are you just going to give me a pill and say goodbye? We'll talk about it later. The questions really are abounding in terms of how I learn to practice medicine, how we learn to value food in our culture, and where we see the implications of food. Now, this is not just a trivial kind of philosophical issue. This whole issue of food as medicine actually really matters. Why does it really matter? Well, we talked about that earlier as well. We have a broken food system, okay? So we know there's certain healthy foods, but the food policies that we have, and this is something that's going to happen later today at the public forum tonight, we're going to talk more about this, it actually is producing these, what I like to call food-like products. Okay, and if you look up here, so they're cheap and widely available. So, oh wait, I see maybe is that like a slice of a lime or is that a grapefruit? No, it's actually candy. It's like some gelatinous material with yellow number 5 and all sorts of preservatives. These aren't foods. These are not food. These are food-like products. Now, what's happening when these are cheap and widely available, and when we don't care and we don't look at the implications of this for individual, environmental, and community health? What happens is something that's happened before. You guys know about the tobacco industry, right? Well, think about what's happening in terms of the chronic diseases. Right now, cardiovascular disease, cancer, and diabetes account for 7 out of every 10 deaths annually in the US, and 77% of the healthcare costs. This is a statistic, and the obesity statistic, you know about that as well. 64.5% of adults are overweight or obese. That's a BMI of greater than 25. I like to share the statistics. I teach prevention to the medical students here at Stanford, and I really put the challenge to them, and I put the challenge to all of us to really think about what are we doing to address this chronic disease epidemic And it's really a pandemic because it's actually increasing faster than infectious disease in the developing world because we're spreading this. So this whole idea of acting locally and thinking globally in terms of the implications is actually really true when it comes to individual health, but also has consequences for the environment. So talking about policy, you know, I like this slide because it kind of talks a little about, puts the big question mark out there, is big food really like the next big tobacco? And talking about truth in labeling, talking about genetic modification of foods, now whatever you may believe in terms of that and what implications it has for our food supply, there's definitely challenging questions in terms of the ecological and evolutionary viability of what this means in terms of the implications that it can have. And there's a lot of science that still needs to be done, but the question is, shouldn't we know about it as consumers? Shouldn't we be informed to make that informed decision? In medicine, we always talk about informed consent. Anytime I even want to do like open up an abscess, if you have like a skin infection, I have to explain to you what the risks and the benefits are. When you go into the grocery store and you're buying your food, is there any explanation? Is there truth in labeling that tells you whether or not that food is going to help you be healthier or it's going to make you sick and make you feel bad? So Proposition 37, there's a I'm not going to say much about that, but I think it's very important, and I think we should think about that. I'd like to also acknowledge for the hospital food work part and some of the other projects that you heard today, I'd like to thank the Blackie family for their generous, visionary, philanthropic support of the work we're doing, and everybody's vision in terms of coming together. And really, it's about collaboration and action, okay? So we need to work together, everybody in this room, to fix our broken food system for the sake of our health and the health of the planet. So everybody, right? Everything that you just heard tonight, right? This is a famous quote from John Lewis in the Civil Rights Movement. If not us, then who? Okay? Us in this room right now. All the different presentations you heard, all from the Stanford student organizations doing these really cutting-edge, interesting things, from the business school to the School of Education, talking about different concepts. Look at the impact that we can have in the community, with the underserved, with the broader community, intellectually, and whatever you want to look at it. This has an impact on real life, and food is really powerful in terms of the impact that it can have, and you can, and we can together. So if not now, then when? What's the purpose of this summit? The purpose of this summit, the purpose of this showcase is for all of us to come together, to coordinate, to collaborate, to create new partnerships and new innovations that can fix our broken food system. All of us can do it, all of us have a responsibility, and tonight we have the public forum, and that's what the showcase is about. So as we're walking down that long hallway together, look around, look at the name tags, connect with people, ask questions, think about what we can do to work together as we enjoy the taste and the sampling of what's ahead. So I'd like to leave you with this call to action. We're at Stanford University. Stanford's bringing this together. Then the founding president of Stanford University talked about how important it is not to just have an idea, but to carry that idea to action. So if you'll beg my indulgence, I will read this. Whatever you have acquired should be an impulse to action. If you've planned something, then carry out your plans. If you have learned the nature of something, then turn your knowledge into execution. If you have gained higher aspirations and your hearts have been touched by a warmer glow, then your neighbors should feel that warmth. There is no virtue in knowledge, in training, in emotion, or in aspiration, except as you use them in the conduct of life. These are the parting words of David Starr Jordan, the founding president of Stanford University, the class of 1905. And I share those to you today so that we can move forward with this call to action. Thank you.
For more, please visit us at stanford.edu.